having tested, especially young people unvaccinated who were found to have this particular strain of the virus and which had mutated. But then, of course, now with the international travel, uh, the it looks like the strain now started spreading out. In the Netherlands, they have reported several cases. In the UK, there are 11 cases confirmed so far, and three particular cases now, surprisingly, are people who do not have a travel history. So it's not like they've traveled abroad and therefore come back with a strain. It's a question of now doing the testing and tracing to see if there are any people that they might have mixed with along the way that led to this particular situation. But of course, what has happened then is as a result, 10 countries in Europe now have confirmed this new strain, the Omicron, to have been tested or found in their particular countries. There are growing calls now for the country probably to go back into lockdown, may God forbid, just when we thought we had just begun to return to a relatively new normal. Hardly a month, because it was from the 4th of October that the entire traffic system for countries was removed, and only 4 countries were left on the list, and then later on lifted, I think about 2 weeks later. But now it looks like we have 8 countries. The number might start growing, all of them in Southern Africa. That is South Africa itself. There is Namibia, there is Botswana, there is Eswatini, there is Zimbabwe, 2 more that I'm getting to forget, but rather 3 more that I'm getting to forget. I think they're not coming to mind quite quickly, but I think we will have identified them as the program goes on. We shall be having medical experts to hear their particular views on this particular situation. So welcome very much. Assalamu alaikum wa rahmatullahi wa barakatuh. This is our global community conversation. I was just doing a quick intro while we allow more people to join us, inshallah. Please just inform any others who haven't joined us to come and join the conversation so that we can kick off and get discussing something that might probably the possibility of being pushed back into a lockdown. Is there or more restrictions, especially for many people who travel? I know many Ugandans who traveled once the travel restrictions were limited or lifted. Many people are in Uganda at the moment. If what I'm hearing is right, it might mean that some people might be forced to return quickly if they are going to avoid the situation where they have to quarantine in hotels, because that is another big possibility that is coming in, considering what has happened. But also from just doing a lateral flow test, which is where we were at so far, you have now to do a PCR upon return. And that's another retrogression, or sort of going backwards from where we thought we had come from. So we'll allow just a few minutes for more people to join us. Bana Isma in the technical department, thank you very much. We have that particular video that I think we will play later, but I think it still has relevance. We have some people joining us from Uganda. We are getting a doctor from Mulago Hospital as well as Platinum Hospital to give us the situation in Uganda, because the situation in Uganda, I think, is one that one would describe as slightly unfortunate, especially in the education sector. Uganda might be the country now that has the longest closure of schools as a result of COVID or lockdown situations or restrictions. And to hear that we now got a new strain doesn't really spell very good news, especially when the promise had been given by government that within January, schools might be opening up. If you have a strain that actually is much more resistant to vaccines, then I think we have a problem. But there's also the whole vaccine hesitancy across much of Africa. Again, another situation that is pending. Although there has been vaccine hoarding by the rich countries, where many countries, especially in the developed world, have attained up to 77%, vaccination target. In Africa, it's less than 5% in many countries. And while on one hand, there is a bit to do with vaccine hesitance, a lot of it also has to do with the lack of the availability of vaccines. And therefore, the bigger problem is these countries, even with the best will, they cannot get the vaccines in time. China, meanwhile, the president of China, Xi Jinping, has announced that he will be availing 1 billion doses to Africa, more doses, new doses to Africa that might help. Of course, China now is taking the diplomatic front, the vaccine diplomacy to another level. And that, of course, now will have implications. But the United States, United Kingdom, and other countries, and France have been trying to send a few doses here and there, but it's just a drop in the ocean, especially considering that many of these countries had stocked a lot of vaccines and then managed to deal with the situation much, much quicker. Now, the question is also the fact that this particular new strain has been discovered in South Africa. The idea that now the kind of approach, the speed with which the country started dropping or blocking passengers from these particular countries raises particular questions. And some experts have sort of said, God has his ways, but imagine if COVID-19, instead of coming from China, had started in Africa, chances are we would not have had a vaccine because they would just have thought it was another African problem, just like AIDS was seen and just left to ourselves, to our own elements. The fact that it started from China, the factory of the world, suddenly exacerbated the situation, and something had to be done to ensure that a vaccine would be developed at a speed that has never happened before. And that speaks volumes. So tonight, I think we'll be trying to hear what the situation is where you are. But during the course of the week, a lot of other news has been happening here in the United Kingdom. We've had Storm Alma, as Storm Alwyn, and this particular storm has caused particular tremors in places. More than 50,000 homes do not have electricity at the moment, and water. So it's gas and electricity. They are out in the dark at the moment, especially in the north of the country. For the first time, actually, I think I honestly, it was on a Friday night, and I was thinking the Prophet ﷺ said, Yawm al-Qiyamah would, happen on a Friday. And my fear was that actually might end up with Yawm al-Qiyamah on that particular Friday, given what I'd seen, because what I saw that Friday, I had never seen before. And that spoke volumes in terms of, what was happening. So, of course, that has affected so many homes. Many people are without electricity. Many are without internet as well. So connectivity has been a problem. Strong winds getting up to 94 miles per hour in some places. Again, the coldest night was Sunday night, -8 in some of the places. Unbelievable. It's not something that we are used to. Of course, with the British, the idea is that the Britons always whinge a lot on a very small thing, situations that other people live through and nothing stops. Here, life seems to have come to a difficult scenario. We'll be waiting. We'll be hoping to be joined by a doctor from Uganda to give us a situation in Uganda. And then, of course, we'll get our health experts, who many I'm sure are on here. But in the meantime, we'll, of course, be hearing from you in terms of where you are at and how this situation probably plays out in your years. Are you worried that we might be going back into a lockdown? There are calls from some corners for people saying we should probably go back into lockdown to ensure that we stop the situation, getting out of hand as it is at the moment. Remember, you can join us in this particular program. We just talk. Ours is Come, Let's Talk with me, KASSIM KAYIRA. And it's open discussion. We always have our conversations open. You are free to sort of express a view as long as it is done decently and respectably. I will definitely be taking in any views, especially to hear what we make of this situation. We have already been through 2 lockdowns. Second one slightly leaner than the first one, but of course it is still a big challenge. If we end up going now, especially many people preparing themselves to go into the festive season, is there a likelihood that we might end up with another lockdown? Or if not, then the restrictions that are coming in, especially the cost of travel now is getting a lot more expensive. What had been inhibitive for many people is probably where we seem to be going back to. May Allah subhanahu wa ta'ala protect us against going back into this particular situation. So in the studios, the technical service, Isma, please, if you're ready, I would just like to play that particular video. This is Dr. Ayome from the African Union, made a very powerful case about the whole idea of the vaccines, because while you see that South Africa now is still struggling, yes, there's been vaccine hesitance, as we said, people not necessarily wanting to go for the jab to have the jab, but a bigger portion, a bigger proportion of Africa, the bigger problem is the lack of the vaccines themselves, not necessarily the reaction or attitude towards the vaccine, but more the lack of vaccines, inadequacy of vaccines. We are going to be needing close to 800 million doses, and just a drop in the ocean of that is what has appeared at the moment. But countries, unfortunately, already have a lot of these vaccines hoarded away, stored away. I think they had bought it, planning for in case of difficult times, but then it looks like they haven't been able. And actually, about another million doses, I think, were incinerated. So they were banned because they expired. And yet, countries outside are still struggling, unable to access these vaccines. So it's sort of a sad state of affairs. But tonight, I think we'll be looking not only in terms of what we are hearing, but also how you think you might be affected. You might actually be on a journey away, or you were planning already, booked your ticket, hoping to be, out in travel. Could you be affected by this? Could you change your plans now, considering the kind of hassle that you have to go through to be able to travel, considering the new regulations that are coming in place? Thank you very much. This is Come Let's Talk with me, KASSIM KAYIRA. We are live on 75W Radio, and we are live on Umma Connect on Zoom and on YouTube. Already streaming there. So if you have any comments or anything you'd like to share with us, just put it in the chat box, or if not, please just come on and have your say. Isma, if you are ready, please, if you can have that particular video of the professor, doctor, sort of making the case on the issue of vaccines, or the lack of, and why now a lot of noise is being made, considering this new particular strain, which has so many mutations and therefore might resist. It is a question of might. It's not like they've been put to the test and they have resisted, but the different mutations now have created fears amongst doctors to imagine, and scientists to imagine that it might be not responding. Part of the government plan has been today officially, the UK government has announced the reintroduction of the compulsory wearing of masks, that is on public transport as well as in shops, and also now to be able to start doing or taking the different tests, PCR tests, especially for people returning who are already going to the lateral flow tests, which was actually much cheaper. I mean, the lateral flow test was about £35 in comparison to between £60 to £110 for the PCR tests. So for the people who are already outside, who have gone to Uganda, who are on holiday somewhere, you come back. That's where you have to do, and then you have to do the tests for the second day and then the 8th day, and not to leave your home until your results return. So that might actually now complicate things for people who are beginning to think, who are beginning to get a breather. Welcome very much. If you have just joined us, this is Come Let's Talk with me, KASSIM KAYIRA. And tonight we are talking, there are a possibility that the government might lock down, or do we continue clocking in, as in continuing with life, but with limited freedoms, as it were. Isma, if the video is ready, we are ready for you. If not, then we'll just open up the conversation and start hearing, especially from people, because we can start actually just doing a quick round robin, hearing from where you are at and how probably hearing this new strain has made you feel. Why don't we just start and fly to the Netherlands, in Amsterdam, where we are joined by Sheikh Tinene Nasakab. Nasakab, assalamu alaikum wa rahmatullahi wa barakatuh. Sheikh Nasakab, can you unmute yourself, please?
Wa alaikum assalam wa rahmatullahi wa barakatuh. Nice to meet you.
Nice to be and have you here this evening. So, how is the situation in the Netherlands? It's where we had the first cases of a flight, a KLM flight that arrived from South Africa, coming in with 61.
Yeah, last week, assalamu alaikum wa rahmatullahi wa barakatuh again. So last week we had that problem here in Holland, Schiphol Airport. The flight was coming from South Africa to come to Amsterdam, but most of the people, there were 61 people, was tested with a negative.
Oh, they were negative.
Sorry, positive. Was
they were
positive with the COVID.
Yeah.
19. So all of them was deported. They deported them to go back to South Africa. Only for those who have the money to pay for themselves for quarantine, for more than 200 euro per each, you can pay for yourself in the hotel. So it was difficult for some people here. Yeah, for those who was coming from South Africa on the same flight, it was difficult for them. But,
now the Netherlands has been introducing.
Who was positive?
Oh, sorry, go ahead, Chair.
They decided to go back to South Africa because it was too much. So if you go to the quarantine for 2 weeks, so you can count every day 200 euro per day in the hotel. You pay for your own money. It's a lot of money. So they decided to go back to South Africa.
Now, the Netherlands seem to have been having a problem now, especially dealing with COVID cases. They were already trying to come up with sort of a mini lockdowns in some areas, considering what was happening in the Netherlands. They had managed to keep the cases down. What happened? What is not happening now?
So the problem, we are expecting any time from now to go for lockdown because they have put on restrictions now in the vehicle centrums. So vehicle centrum means I'm sorry, sometimes I'm confused with the Dutch language.
Yes.
But in the shops.
Yes.
They close here the shops we close at around 5 o'clock. Shops and supermarkets. So there is a restriction. So we are expecting any time to go in lockdown from now. But shops and supermarkets we close at 5 o'clock exactly.
Do you have to wear masks? Is it a must to wear masks in public?
It's a must. It's a must. Put on everywhere in the public transport, in the shops and the supermarkets, we have to use the masks. It's a must. And another saga there was last week. No, this week on Monday. Today is Tuesday, isn't it? Today is Tuesday. So there was another saga. There was one couple was coming from Spain. Yeah. So that couple, they test them to the airport here, the main airport in Amsterdam.
Is that
was positive? Yeah, there was positive. So decide to go in quarantine in the hotel because they was going in the hotel. So they told them to go in the hotel to spend 2 weeks in the hotel. But the time to go back to Spain, the ticket was, they were supposed to take the flight yesterday. So they decided to go to the airport to take the flight to go back to Spain. But they catch them.
They arrested them. They stopped them from boarding.
Yeah, they stopped them to go back to Spain. So they told them to go back to the hotel because the quarantine was still on.
So would the government or the airline be paying then for their hotel? Because if they have left the hotel, who would be paying?
No,
are they taking them back to the hotel to pay for themselves?
They have to pay for themselves because the hotel was the hotel was what they paid the hotel for 2 weeks. It was 3 weeks, but they decided to go before completing the quarantine, and they stopped them, and they told them to go back to the hotel. So the police escorted them until they reached to the hotel. So now they are still in the hotel now. Right. Until they finished their deadline of the 2 weeks quarantine.
Wow. And how about schools? How are schools? Because like in the UK, there was a time when actually many infections were coming from schools. What is the situation in the Netherlands? How are the schools coping?
The schools, they are open. They are open. All schools, they are open because everybody here was already vaccinated from 16 years above. From 16 and above, everybody was vaccinated. Only those who was refused. All of us, we are not the same. We are not on the same people. So some people, they refuse to vaccinate it. Some people, they say, yeah, for us, we can manage. So some people, they are not vaccinated here in Holland, but 75% we are vaccinated.
Have been vaccinated. Fantastic. Okay, thank you very much, Sheikh Nasaka in the Netherlands. Stay on the line, please. We will continue the conversation. Let's go to the United States and here. Hasfa Gasuja. Assalamu alaikum wa rahmatullah. Hello, Hafsa. Hafsa, assalamu alaikum wa rahmatullah. Are you there? Hello, Hasfa. Are you on and off? Dr. Karika in Kampala, please, when you come on, let me know because I can't tell. I don't know if you logged in with a particular name. If you can just point on raising your hand, please, so I can know if you have logged in with a different name, please. But other than that,
she said she can't talk now.
Yes, right, I've seen Hasfa's message. Yes,
maybe
I was hoping that we could hear from the United States, but if we have somebody else from the US, maybe we can just get to hear from them. I see Salma here. Salma, I'm assuming you're in the United Kingdom. Assalamu alaikum. Hello, Salma. Or is it Salma in the UAE? Salma, are you there? Hello, Salma. Okay, I'll just go to Hajat Sara. Assalamu alaikum.
Wa alaikum salam wa rahmatullahi wa barakatuh.
How are you today?
I'm all right. How are you? Yeah, the situation is quite worrying because yes, when we had just started thinking about planning to go for holidays, yes, it seems we are going to be locked up again for how long, only God knows.
Yeah.
And I'm even wondering whether it was even any worth any of us getting vaccinated when you hear what is being said on TV and radios.
They are inviting us for a booster jab to make sure.
I've already had mine. Mine is done. Yeah, I had my booster. Yeah. But I've also heard that the elderly people need to go back for another one, a fourth one.
A second booster.
Yeah, a second one. So they'll have 4 injections done. So it's quite worrying. We don't know where we're heading, really. And if one is to travel, I think they have to think twice because it can be very expensive.
Were you planning to travel at all?
No, for me, I was like, I'm not going to go anywhere until maybe April next year because I knew that with winter, things might go bad. We've always had it worse in winter, not knowing that new variants will be in, but only also expecting the virus to be much, much more than it was because winter time is when it really thrives. So that was my worry. But now I don't know. Worry for those who are already in Kampala. We've already started calling our friends and telling and families who have traveled that you better make plans to come back because it might end up being more costly than you thought.
Yes.
Yeah.
No, already there are discussions around because the tests are getting introduced, the PCRs are getting introduced. You have to do a PCR other than doing the lateral flow test that we are now adopting, at least once you have been doubly vaccinated. But that's definitely something of a concern, especially for people doing the traveling. But from a perspective within the UK, I mean, is it probably drumming up too much noise about it? Because with the Delta, that's exactly what was said. Then came the Lambda, and that's what was also said. Now, all of a sudden, now we have this Omicron and the kind of noises that are coming in. Do you think probably it's being blown out of proportion?
I think they are quite justified. We lost so many people, and we don't want to go back there. Because UK was always very resistant to put on up measures or restrictions like other countries. And we paid a very, very high price for that. So anything that they can do to prevent any more deaths or hospitalization, I think is right to be done. I think they have to take action as soon as possible.
I see a doubting Thomas already in the chat room saying I will never be vaccinated. It started as 1 jab, now 4. This is crazy.
I hope that is not my son, Baker.
I don't know why I have a strong feeling it might just be him as well.
Because he's always he's one who is quite anti-vaccine, so he's one of these caremongering people. I know you can excuse me for saying that.
Yeah, no, well, we already.
But I do suspect it might be him.
Yes. No,
Yeah.
because I think it's about the kind of perception that we are getting from the community perspective. I can see the laughter in
Is
in
it
the
him?
chat. It must be him, I think, from the,
Yeah.
from the laughter.
Yeah, it is him. I've just noticed. He's the one there.
The laughter speaks volumes. I think he's given himself away.
Yeah, yeah.
Yes.
But,
okay. Well, just probably cross. If there is anyone who is.
well, give him a mic. Let him say his piece. Maybe he's got something to educate us on about.
If you start with vaccine hesitance at this start of the program, then you know the conversation is just going to take a totally different path.
Well, maybe we'll convert him. We might convince him.
We've had almost 3 big sessions, and in each session, I think he has been resistant. He's been hesitant, and I have no doubt. Becca, bring it on. What you're saying? You're not going to have the vaccine.
Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum assalam wa rahmatullahi wa barakatuh. Undoubtedly you.
Definitely, the one and only. For me personally, it will never happen. I will never be vaccinated. I know maybe in the end I might have to be forced, unless if it's by law. But right now it's not by law. So for me, it's not going to happen because I feel like there's no way I can go to a doctor and they basically give me medication when they don't even know how much dose I need. That's what's happening right now. You know, if you can see what's in Israel right now, in Israel, they're saying every 6 months you have to get a booster. Every 6 months you have to get a booster. Like, come on. That wasn't part of the prescription in the beginning, was it? It came as one, it came as one jab. That's why they said it's going to be one vaccine in the beginning. Then afterwards, second. So they're prescribing, they're making things up as they go along. And also you can get vaccine, sorry, you can get COVID if you're vaccinated. So really, and I've buried people that have been vaccinated.
But Becca, every other jab that comes is an improvement on the former one. And that has been the explanation. That with each one now, the weaknesses that were found with the previous one are corrected. So you get a newer version, just like your iPhone.
So what happened to those that got the wrong jab in the beginning?
No, it's not the wrong jab. It just means the other one is weak. It is just boosted. And that's why you're getting the booster jabs now to make sure that.
I know someone that got a booster jab. They ended up in hospital after getting the booster jab. You know, and they told them you don't need it after they were sending them messages that you actually need to go get the jab, the booster. You know, so everyone, it should be by choice. But if you find that most people are going to get the jab because of work or because they want to travel. Because most countries have said you cannot enter unless you are jabbed, you know? So it's not fair to be enforced on, because people are dying from so many other diseases than COVID. Yes, we're losing people. Even me, I could be taken by COVID. But it's a thing whereby it should be my choice whether I get vaccinated or not. It shouldn't be someone, Boris Johnson's passing the law that, oh, go get vaccinated, go do this. No, it should be my choice, you know? So I don't feel it's right to be forced to take the jab, really, when, you know, because even people.
Are you worried about this new strain, or you think it's a hoax?
Right now, I have no idea what to believe, because everyone has their own opinion in regards to this, you know, because they've seen variants they've seen cases in the UK, in the US, in so many other countries. But why is it that it's only African countries that have been locked down? So it becomes to be a political issue, if you were to ask me. You know, that's why I'm like, it's not fair to see that African countries are told. Definitely. I don't actually, even what I'm thinking now, maybe they've created one for Africa. This new variant is the one because the first vaccine and the first wave rather than the second wave, Africa wasn't really affected, you know, and we don't have no gloves, we don't have no PPEs, you know, we have no masks, you know, people don't follow social distance back home. So I think maybe they've mixed this one, they've gone back and, you know, but I don't know.
No, but this was seen in people who are not vaccinated. Actually, that's where it started from. It started from young people in South Africa who were tested by the South African government, by the way. And we are found to be, you know, they were unvaccinated. And then when they went to test them, they found that they had this particular strain that was whose mutation was kind of worrying, according to the doctor.
Mm.
I wish we could get some medical experts, and I was hoping that we'd get Neil Fakaswite here, at least to come and give us now the feeling within the wards now, you know, what the feeling is in the wards at this particular moment in time.
Really, I struggle to. I don't even know who would ever convince me to get the vaccine. You know, I have no idea if anyone would. You know, let's see. I don't know. My mom's been trying for the past, I don't even know how long, and she's not been successful. So, but you know, it should be. It's not. I'm not saying whoever is taking the vaccine is wrong. What I'm saying is it should be my choice. Do you get what I'm trying to say? What I'm saying is it should, because when I have a headache, no one is telling me, forcing me to take paracetamol. Do you get what I mean? So it should be my choice, because this is a medical issue. This is my body, you know? So you can't tell me by force you have to do this, you know? So, because if you're not vaccinated, you pass it on. But even those that are vaccinated, they also pass on COVID, because I know someone that we had this same conversation we're having now. They got vaccinated in March and they got COVID, and they're telling me, I thought when you get vaccinated, you don't get it. But it should be a personal choice. But if you ask,
Sarah, it looks like you have something you want to say.
Yeah, I want to say to Becca that much as it is his choice, but also the government has a duty of care to look after him and protect him. So you may be really hesitant to make the choice, but then maybe there has to come a time when the government has to make it for you out of protecting you.
If the government cared about me, they wouldn't be selling cigarettes so that people smoke around me. So that, you know, do you get what I mean? Because you find people smoking around their kids, they're literally giving their kids cancer, you know. And on the cigarette thing, it says
I think there is a big difference between cigarettes and virus, because this is something which catches you and kills you there and then. Yeah, it is killing at a very high rate, and it doesn't give you any chance to live for years. You can live with cancer for a long time, or you may not even ever catch it. But with this one, it's quite a different story. For me, one of the reasons that I took my vaccine was when I looked at the number of people who are dying, they were not the same number of people that were being vaccinated. And I was like, if they are looking at 100,000 who have died so far, and they have now vaccinated millions of people, then they wouldn't be so stupid to kill the millions when they're only losing hundreds.
Absolutely.
So that made me take the vaccine, because at the end of the day, I know that anything that they can't be, I mean, vaccines are not curable, but they can be given, you can be given what is it? You can be given a vaccination, and then you can have immunity, and the body can be helped to fight it. Becca, you have to really take your vaccination. We don't want you dying. Well, we can't prevent you from dying, but it worries.
I've buried people that have been vaccinated, Hajat. Wallahi, I've buried people that have been vaccinated and they've died from COVID.
But if you look at the number of people who have died, who are vaccinated, and those who died when they were not vaccinated, which is the greatest number? Because everything has
every person that lives the vaccination center lives with their arm hurting, you know.
Yeah, you have to look at the numbers, Becca. Yeah,
I know,
because everything comes with a risk. But which is the greater risk? That's what you have to think about.
Absolutely. Well, I was hoping that we'll get. I've seen Zamunda. Zamunda, is that Dr. Kadika at all? Dr. Kadika, when you join us, please just put up your hand so that I can know you are there, so that we can hear from you. I've seen Farida Namsoke. Farida, assalamu alaikum. Hello, Farida. Hello, Farida. Can you unmute yourself, please? Hello, Farida. Okay. Go to Hawa now. I think Farida, are you able to unmute yourself, please, once you unmute yourself? Or in the meantime, just to help at least open up our conversation much further, let's get to Isma, please. If you can play us that video, I think it will help us to inform ourselves and inform part of the conversation we are having. Becca might have, you know, a field day on this. After hearing from the doctor, this particular doctor, I think I was really, really happy with the manner in which she addressed this particular issue, considering the fact that, you know, this this new strain came from South Africa, and you see the immediate attitude. 10 countries have already confirmed, you know, having this strain or getting this strain. but more countries are actually closing their borders to passengers from South Africa at the moment. And, not actually South Africa, but Southern Africa. That's 8 countries that have been targeted. And the thought has been, imagine if COVID-19 itself had actually started in Africa, probably would be having a totally different story playing out at the moment. Bwana Isma, let's have our video, please. Let's help to inform our decision. Baker, I have heard you. I can see you're still on the fight. Let's hear this doctor speaking on the BBC.
African Union's Vaccine Delivery Alliance, Dr. Ayowade Alakija. Dr. Alakija, thank you for your time. Do you feel that this was inevitable in some way?
Thank you, Philippa.
I'm pleased to say that joining me now live from Abuja is a co-chair of the African Union's Vaccine Delivery Alliance, Dr. Ayowade Alakija. Dr. Alakija, thank you for your time. Do you feel that this was inevitable in some way?
Thank you, Philippa. It was absolutely inevitable. And may I say firstly that had the first SARS-CoV virus, the one that was first identified in China last year, originated in Africa, it is now clear that the world would have locked us away and thrown away the key. There would have been no urgency to develop vaccines because it would have been expendable. Africa would have become known as the continent of COVID. What is going on right now is inevitable. It's as a result of the world's failure to vaccinate in an equitable, urgent, and speedy manner. It is as a result of hoarding by high-income countries of the world. And quite frankly, it is unacceptable. These travel bans are based in politics and not in science. It is wrong.
I hear your anger about the immediate reaction and about the lack of action beforehand.
Yeah, absolutely. I mean, let's just hope this is a dress rehearsal that we're seeing right now with the Omicron variant and not the main event. The science, we don't know yet. What we can say about COVID, what we can say about this current variant is that the best thing that we know is that we don't know. So this is hopefully a dress rehearsal. But because until everyone is vaccinated, no one is safe. But what exactly is the global playbook on this? What are we planning to do? Are we just planning to act politically, knee-jerk reaction, so that we can satisfy those people within our countries that we're keeping those, those unvaccinated Africans out? Why are the Africans unvaccinated? It's an outrage because we knew we were going to get here. We knew this is where the hoarding, the lack of IP waivers, the lack of cooperation on sharing tech and sharing know-how. We knew this is a crossroads that it was going to bring us to. It was going to bring us to a variant. It was going to bring us to more dangerous variants. Why are we acting surprised? Why are we locking away Africa when this virus is already on 3 continents? Nobody's locking away Belgium. Nobody's locking away Israel. Why are we locking away Africa? It is wrong, and it is also time that our African leaders stand up and they find their voice. African leadership need to sit up in this moment. Our presidents need to wake up in this moment and realize that this is not business as usual. Their continent is at stake. Our lives are at stake, and we cannot allow the world to do this to us.
You compare the situation now to the situation when the virus came out of Wuhan, came out of China. And if there'd been an instant lockdown and a travel lockdown, we'd be talking about a different pandemic. So the instant reaction is surely something has to be done in the very short term to try to stop the spread of the virus, this variant.
Absolutely, Philippa, but something needs to be done to everywhere. Let there be, my recommendation is have a coordinated global shutdown of travel for the next month if you want, but don't single out Africa. Don't single out South Africa. Botswana actually is where the virus was first identified. But do you know what was going on with Botswana a few months ago? The Botswanan government ordered 500,000 Moderna vaccines at $29 per dose, much higher than the rest of the world paid. They did not get those vaccines because other people jumped ahead in the queue. Moderna supplied to other countries and did not supply to Botswana. And so now we have a variant. Do we know where this variant originated? No, we don't even know that yet. It could possibly be that the excellent science in South Africa has shown it up, but it could very well have come from anywhere else. This is discriminatory, it is xenophobia, and it is wrong. Let us follow the science. Let us not follow politics. Let us share the know-how. Let us allow African countries and others to produce their own vaccines so that we do not get to an Omega variant, which we cannot absolutely control.
Dr. Alakiju, we have to leave it there. Really important to hear your voice and what you're saying. Thank you.
Thank you, Philip.
Well, you have it. You have had it straight from the horse's mouth. I'm sure now this might actually help to inform our conversation going forward. You've had the kind of double standards when it comes to dealing with situations. When situations arise like this, you've seen the case of Botswana, where the first case of this particular new strain was actually discovered. It came, from a country that had even paid $29, and I'm repeating Dr. Ayola's submission here. Zamunda, I see your hand is up. I'll unmute you and get ready. I'm just saying that now you can actually tell from the doctor's anger, probably if she's justified. I'm sure now, as an African, probably you might have a view. Zamunda.
Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum assalam wa rahmatullahi wa barakatuh. You king of Zamunda?
Amakuru ya boss.
Amakuru ni meza murakomeye muraho.
Shani shimekuona.
Amin. And who is this?
My name is Imam.
Imam.
Yes, and
Yes,
I reside here. I reside here in Trumpland.
Oh, in Trumpland, in the United States. Fantastic. Now we actually
Yes.
wanted to get a view, and very interestingly, just yesterday but one, I think I shared the car with an American, a very huge Trump supporter, and for the next 30 minutes, I was given a full lecture about the Trumpism and so on. And,
Yeah, it is serious. It is serious. There are people who love Trump. They really love Trump.
It was interesting.
So you can't tell them
kind
anything.
of vaccine story and this whole new strain and what his interpretation was. So maybe just for starters, what is the situation in the US now?
Wallahi, alhamdulillah, here in the US, they hype when they want to hype it. Yes. Then they cool it down when they want to cool it down. but for them, I think the US they have their own way of, playing politics and also playing with the public, and also here the public, it will make noise if things go like if they hype it too much. Mm-hmm. So, but the reason I just raised my hand was, what I had the last Juma, the past Friday that we just left behind. Mm-hmm. The Sheikh said, he was talking about faith and having faith and what difficulties and challenges and the situations that we are in around the world, how it destroys our faith and how people end up being in shirk by just accepting and taking things the way they are, and also believing that because we have coronavirus, that the vaccine is the ultimate solution. Yeah. So he was telling us, as we go through these difficult times with the diseases that we don't know where they came from, we should always mind our faith. Our faith is at stake because, as you know, we are saying things that, wallahi, for me, I feel sad because we're saying, if you take the vaccine, you won't die. Mm-hmm. The Sheikh said, yes, the Prophet ﷺ said in the hadith that we should always protect ourselves. But we should never think that the vaccine or any medication will protect us. Allah subhanahu wa ta'ala will protect us, but we should always take precaution. But also he cautioned us that don't commit shirk by thinking that Allah won't protect you, but the vaccine will protect you. Mm. So as we know here in the US, I actually wanted to, because since I got a chance to I listened to you, but for me, I come when you are in Rwanda. So I was in Rwanda, so I used to listen to you a lot on TV and radio. Mm. So I wanted to see if you know the numbers, like in people who have invested in these things. Mm. Because here I hear so many stories, like people who have invested in this thing of the vaccine and all that stuff, they are making a killing. Yeah. So it all plays. We shouldn't take it as it comes. Or they find it in South Africa now. Or what are they trying to sell? There is tablets, whatever, the medication, the tablets you buy, and you take those. So we should always we shouldn't look in one angle. We should always widen our thinking. And like, what is at stake? Is it our faith? Is it our health? Is it our continent? Is it our countries? It is our families. So we should always measure these things, but we shouldn't forget the ultimate saver of our health is Allah subhanahu wa ta'ala. And he told us, the Shaykh said, if whatever you're going to take the vaccine, say Bismillah. But never say that the vaccine will save anyone from dying. Say, if you want to take the vaccine, wallahi, take it, but never, never, it should never come to any Muslim thinking, oh, because wallahi, brother, what is happening now with the vaccine? People who have taken vaccine, they have started discriminating people who haven't taken vaccine. There was a hakika recently. There was a hakika, and people, wallahi, were discriminating against others. Oh, did you take the vaccine? No, I haven't taken the vaccine. Oh, how dare you? So we have to check ourselves, because this vaccine, we don't know where it's coming from, and we don't know how it's going to end. But for me personally, I've had people who have invested in these things. Wallahi, they pray that it keep on going.
No, actually, Iman, I think you raised a very important point. And before I actually go into it, because I might forget the point I wanted to raise, I'll just say it so that I don't forget it, and then be able to say what I wanted to say on this. And that is, even here in the United Kingdom, there has been cases that have been brought up. Rich people, very rich people who run businesses and who are close to the party in power at the moment, who are the Conservatives, who got business deals. So there is definitely, you know, there is definitely something to do with the business aspect of it and who is making a killing out of it. You will hear that the AstraZeneca now has said that starting next year, they'll be earning a bit of a profit, because when they provided this particular vaccine in the first instance, they provided it as sort of support. They were just received money for research, and whatever they put out, they were not earning. It was actually at cost price. But right now, starting next year, they were hoping to start earning a bit of a profit. And that speaks volumes, I mean, in terms of that. But that's the other side of the story. Of course, in terms of vaccines, where it has been proven that in cases where you've had vaccines for other diseases, let's think about, for example, the 6 killer diseases, you know, the normal one, the measles, the whooping cough, the yellow fever, those ones that when actually vaccination has been brought in, the difference that it has made to people's lives is actually visible. So in situations where we've had, you know, it's not like we've not had failings in particular areas, but vaccines have been seen to work in other instances. So while on one hand we are putting our trust in Allah, the Prophet ﷺ actually said in the hadith that is normally quoted, it was about the man who came to the Prophet ﷺ, when he came to the mosque, left his camel outside and went to pray because he knew he had come to Allah. Since he had come to Allah, everything would be fine. He came back and he had lost his camel. Oh, no, he found his camel, and out of excitement, putting his trust in Allah, like feeling that Allah had saved him, he even went back now to thank Allah for prayer and wanted to come back, and the camel wasn't there. The Prophet ﷺ, of course, now comes in to explain this, and he said, he says, tie it first and then put your tawakkul in Allah. So the tying it is the element that we are going for those who want, of course, to go and get the vaccine. So the question I wanted to ask was that in the US, since you've said that there is kind of mixed reactions, but in the US, you have states. The federal system of government gives governors particular powers where they can refuse central authority, say, from what is being said in Washington. So each state seems to be taking a different perspective to this. There are particular states that never locked down and they've continued with life, which I think paints a different picture.
Yeah, that is very true. And also here, from what I know, this is not a federal mandate thing. Mm-hmm. So it all depends on the individual states, especially like the Republican states, mostly leaning Republican states. For them, they are totally against the vaccine and vaccine mandates and all that stuff. That's why in the US, they can never mandate the vaccine. So what they do, they will just push it to the states. And then the states will say, I'm not going to do it. I'm not going to mandate it. And then they push it to companies. And they say, company, it's up to you to do it. But because it's not a federal thing and they haven't, said it is, you have to do it. So everything is left there. And here, the politics of the US is completely like different, you know? So even if you force it to people, if you force that people take it, then you end up in court. And they don't want that to happen. So they want it to take it at a slow pace. They give people incentives to go get the vaccine. Incentives, they say, please go take it. And then the more they say, please go take it, for example, the Black community, they say, no, why are you giving us money now? We've been dying for years. You know? They haven't
vouchers
forgotten.
for someone who has been vaccinated. Like we used to give blood and they give you a bottle of of Coca-Cola and biscuits. And that would be an attraction to go and donate blood. What are they giving?
Thing.
Vouchers or what?
They give you vouchers, but like in the state where I live now, in Maryland, they used to give, like, they give you incentive if you take your child 5 to 12 to get vaccinated. They enter into a lottery, sort of lottery, so they will win a lot of money for college, you know. So when you go to Black communities, you go to the native people, you know, the Indians, they are all skeptical. Like, why are you being so nice now? You know, and people have this thing of saying, why do we have so many vaccines? And then how do you know which one is working? Now, before they told us you cannot mix them, you know, for those people who have taken one or the second one who are taking the booster, now all of a sudden they're like, oh, you can mix them. Now you can take those people who are taking JJ. So
the Pfizer.
Yes. Yeah. So in America, they won't force anyone to do it. They can never force anyone to do it. Especially for people who are working, they will never force anybody to do it. Otherwise, we have had so many legit stories, people ending up being paralyzed, and the American government is the one who reports this news.
Oh yes.
They will come, they will tell you all these things, but then they will say, oh, please, we know you go.
They always declassify information after every 10 years, after every decade. They will declassify information, and then you come to realize, especially what happened in Guatemala, I think is still very fresh on many people with the tests that were carried out on infecting people with gonorrhea and syphilis, and then trying to develop a vaccine. Now, those memories are still fresh. And even in Nigeria, I think we've had situations, a case that was made against Pfizer, where it ended up paying a lot of money in compensation as a result.
But here, the federal government also is just recommending. It doesn't tell you go take it. That is a catchphrase. It recommends
even here, I think
you.
The thing is highly recommended. Of course, with health workers now, National Health Service, I think they are making it compulsory now, and people working in care homes, they are making it compulsory in one or another, and there has been a lot of protest to that effect. But definitely, I think, well, that's very nice. Thank you very, very much, Iman, for the picture in the United States of America. In the chat room, Sarah was saying, I took the vaccine not because I wanted to, but because I knew I would not win if I didn't. Jamila is saying, Assalamu alaikum, just joined us. Welcome very much, Jamila. You missed quite a bit, but definitely never late. We can always catch up. We all do not trust the vaccines, but we do not have a choice. Baker says, why hasn't COVID finished off Africa where no one follows social distance? Of course, the dynamics are slightly different. You go to Africa and you find different circumstances playing out. Hasfaka Sweet just says, Shekeke, your voice disappears. I've noticed, so I'm avoiding the movement, but sometimes you get excited and there's no way you want to move. So program is come. Let's talk with me, KASSIM KAYIRA. We are 54 minutes. Oh my God, already gone. Time flies when you have an interesting conversation. But we are talking about the possibility of a lockdown, considering what is happening at the moment, the new strain of the COVID-19 virus that is suddenly come up. We were thinking we are dealing with Delta, we were thinking we're dealing with Lambda, and then all of a sudden now we've ended up with a new strain coming from South Africa. But I think Dr. Ayeola made a very strong case about the whole idea of trying to punish Africa for the failure of the rest of the world. No vaccines. There was, for example, a program that was put by the UN and the World Health Organization, which was supposed to provide vaccines for Africa. That was through the COVAX project. And it was meant to provide vaccines to help these countries, poor countries, access vaccines. To see that many countries like Uganda, actually, despite everything that has been said, the government paid money up front to try to get vaccines. But if a country like Botswana, which actually has the best GDP per capita on the continent of Africa, failing to access vaccines for which they had paid even a higher price, $29, failing to get the vaccines in time because other countries are already in the queue and jumped the queue and got the vaccines, I think speaks volumes. In the UK, for instance, the stocking of vaccines was actually unbelievable because the UK government had actually invested in the AstraZeneca or the Oxford vaccine. And because they had invested, of course, they made their pre-orders and we managed to get so many vaccines that some of them are still in stock, unused. We've heard about a case of nearly more than 1 million vaccine doses that were incinerated or burned because they had run out of, they had run the expiry period and they couldn't even be gotten to Africa, where only about 5% has been vaccinated in comparison to 77% elsewhere, especially in the West, where countries have already vaccinated. The problem with COVID, actually, someone I think used a very philosophical but publicly used word, which is that COVID-19 has come in as an equalizer. Equalizer because it doesn't matter whether you've been vaccinated or not. If someone who is unvaccinated gets it, they can still infect you, you who has been vaccinated. So you are only safe, you're only as safe as all of you are vaccinated. We can only have safety once the vaccination has reached on everybody. Nasakab, you seem to have been touched by the doctor's words and you wanted to come back in. If you can unmute yourself, please. Nasakab in the Netherlands. The Dr. Ayewola seems to have touched a chord on you. Sheikh Nasakab? Sheikh Nasakab, are you there? Oh, you were there 1 minute and you've disappeared. Are you unable to unmute yourself? Okay, whenever you... right. Assalamu alaikum wa rahmatullah. Welcome back once more. The doctor seems to have touched a chord.
Go ahead.
Yes, the doctor seems to have spoken to your mind.
So you need to explain about
Nigerian doctor. Yes, when the doctor spoke, you seemed happy with her submission, and I wanted to get your reaction to that.
Dr. Aladi, yeah, a Nigerian woman.
Yes, yes.
Yeah, her comments, but I like it. Her comment was okay, because what I'm suggesting, because for what I am supporting, I support everybody to be vaccinated. For me, that is my issue. I support everybody to be vaccinated. That is my issue.
But if you see what is happening on the continent in Africa at the moment, I mean, only about 5%. Now, actually, now the problem even gets bigger. One, there are not enough vaccines to vaccinate people. But even where people are willing to be vaccinated, there's the hesitance on the other hand as well. People who are doubtful, the bakers of Africa, who are not willing to go and get their vaccine. That's also still there, based either on myths, based on past experiences as well. People still have those fresh memories of what happened to them or happened elsewhere, and therefore they are sort of shy to go and get vaccinated. Now you have a double problem, but yet, actually, thus far, COVID has not affected the continent of Africa as much as it has affected elsewhere. And may God forbid, I mean, it says, Alhamdulillah, God has protected Africa, considering our means and what we don't have. Jada Sakab, are you there?
I'm still there.
Okay, all right. Okay.
The problem in our continent, KAYIRA, is that even if there is a place for vaccination for free of charge, people, they can fail to get their transport to go there. We can focus on the vaccination, but the means of transport to go there to be vaccinated, also it's a problem to the people.
Yeah.
Wallahi, also it's a problem to the people.
Absolutely.
Even if someone can say, no, I can go to be vaccinated, but I don't have nothing to eat. People, they can concentrate to the place of work to get something to put in their pocket instead of going to be vaccinated.
Yeah. Okay, fantastic. Amina Amba, assalamu alaikum. Welcome to the conversation. Hello, Amina. Hello,
Hello.
Amina. Yeah,
Hello,
Assalamu
Sheikh.
alaikum. How are you
Walaikum
today?
salam. I'm good, thanks. And you?
Alhamdulillah. I just seen your comment and I think it speaks volumes, but I think the doctor has touched on it, where you are saying why are African leaders not putting together to develop, to help fund African scientists to be able to produce vaccines?
Yeah, I think so. Because when I don't know if you heard about this, but when the COVID had just started, there was some scientist in Uganda. I wasn't there, but just read.
Professor Ogwang, I know him.
Yeah, who actually came up with something, developed something to basically treat or help with the COVID. But he was stopped and another one was arrested. So, and people tried coming up with these natural remedies, like the home remedies, but they weren't supported because truly, Sheikh, I see that right now I'm in Leighton Stone, and when the COVID was at the peak, most of my friends, alhamdulillah, I haven't caught it, I didn't catch it, but most of my patients, my friends, my family caught it. But the treatment we used, we were actually purchasing it from a Ghanaian pharmacist. So that was what actually helped everybody I knew around me. Yeah, that was the treatment we used. They came from this.
What was it? Was it a concoction from Ghana? Or?
No. It was actually it was antibiotics, but it was a put together mix up.
Right.
Because he was a very intelligent man, because he actually threw in the zinc, the vitamins, vitamin C, zincs, and then different antibiotics, like about 3 sets of antibiotics, and then he threw in things like that. So, and these are the things which really did help people get back their health, and he was an African.
Now, Amina, the problem is the cost of producing a vaccine, especially you see a lot of times, most vaccines in the past would take 5 to 10 years just to be developed. And a lot of times it wasn't so much because of so much testing that had to be done. It was more to do with the amount of money it takes to actually fund research into this. So governments actually closed their eyes in the West and funded, provided money so fast to go into the production of these vaccines, which brought them actually part of the suspicions people like Baker now would have is, this vaccine was developed so quickly in comparison to previous, and no harm intended. I'm just mentioning Baker for purposes of the conversation. But if you see the amount of time it took to develop these vaccines, it was actually record time. It had never happened before. Normally takes about 5 to 10 years. Other vaccines, for example, for malaria or even AIDS, up to now, we haven't come up with one. The cost that goes into the production of such is so inhibitive that many, especially in the continent of Africa, highly indebted countries, being able to sit together and agree even to do that, because it would mean many of these countries would now need to put together, for example, through the African Union, and then raise the money for that. But even that is difficult because before you even think about funding research into vaccines on the continent, African countries decided to pull together money to go and get from the World Health Organization or through the World Health Organization to access the vaccines through COVAX, which hasn't happened. So the kind of frustrations that many of these countries are facing are just multiple. Agreeing, first of all, on how to agree. Agreeing on how to disagree is one thing, but agreeing on how to agree in the first instance for these African countries to sort of say, let us pull together money and we support a scientist to come up with this. There are competing needs between countries. For them to imagine that, for example, Ugandan Professor Ogwang, be funded to go and produce a vaccine, that would bring all the Bitiwa to Uganda instead of being the other countries. So countries still have that nationalistic ideas to themselves, forgetting that what we are dealing with is actually much bigger. I mean, I stay there, don't go away. I see Zamunda is back again. I think he might have something to interject in here. Zamunda, come again.
Barakallahu fikum. The source of information. Wallahi, it's amazing. You know, mentioning Uganda, it's a great. Like, we need to make dua, special dua for Uganda. Now, you know, you talk about the doctor, and then we have the Musenero, the Musenero and Museveni. They are also coming up with something else, where they bought the mouse for 8 million each.
8 million it costs to buy
8 million each, and then to fly. I guess they got the visa and the passport for them. So, Alhamdulillah. Yeah. But since we have a vast audience from different places in the world, I wanted to know, we hear only Moderna, Pfizer, and JJ vaccines.
Yeah, Johnson.
Do we know how many different kinds do they have in China, India, Russia, and how do they come to be to work on the same thing, same virus? Do we know that information? Or because I think we focus on those, but China, I think they have their own thing they're dealing with. Russia, same. India, they have different also different vaccines. So do we have a clue on what are they dealing with? I guess the new.
I wish we had the science. Actually, I'd invited the scientist, but unfortunately, he's working 3 days flat out. Is the message I received from him. He's working 3 days flat out. He's actually on the front line of this COVID emergency. He's really, like, you know, at the heart of it, and he's been part of the research in Oxford. So he would have been a very fantastic person to speak to tonight, but we couldn't get to him. But having said that,
Brother KASSIM.
Yes.
Wallahi, it's amazing you're saying that, because I know some Ugandans here in the US who are working with NIH.
Yes.
Through all this, whatever is going on. So it'll be amazing. So if we have such a people, such a brothers to enlighten us, of course, here they have a lot of restrictions on what they can and can't say. But it will be nice to have them. And I'm gonna call this brother and ask him, maybe he can give us some insight on what's going on.
Oh, fantastic. I mean, that would be good. Even if he came on for 5 minutes, doesn't have to stay to the entire end of the show. It would be good. It would be good just to sort of get an insight, a quick one, and probably, you know, we can take it up from there. But the point I was trying to say in answer to your question, and Amina is still there, I'll need her to come back and on the argument. We're talking about African leaders participating. China has offered to give Africa 1 billion doses of vaccine, of course, their vaccine. And there has been this particular doubt, and that doubt was created in the West. You know, like, can we trust a Chinese vaccine, which was developed so quickly? But you see how quickly China managed to get back itself, you know, back to normalcy. The factories are working. They have contained a lot of, you know, they have contained a lot of the cases, you know, including from where the first outbreak came from. But China has their own vaccine. Russia actually had one that was named after the president, and it's called Putin. It has something like Putin to that name. Russia was also trying to come in. And what is beginning to happen, or is meant to happen, is the kind of vaccine diplomacy. India was producing the vaccines, but it was the kind of the generic aspect, just like we get the paracetamol that is meant for the European market, and then a paracetamol that is meant for the rest of the world or third world. And India was producing on behalf of these countries. Actually, it was the AstraZeneca, but the version, the Indian version, which is a generic version. So that one, of course, now was, you know, came into doubt. A lot of it went into South America, into Latin America. So that was Brazil, that was Mexico, all the countries in South America mainly, and then a bit of Africa to a little extent. But then they were sort of running out very quickly, because countries like Britain put in orders, and sort of the orders were instructional. It was not a question of asking, they were sort of ordering. And that affected now the supply at the start. So ultimately, we end up with a situation where, you know, while you have all these different vaccines, if scientists have worked together to come up with this, there's of course now the competition between countries, each country wanting to be the first one to be able to break through. And that has implications, because the moment you have that, it simply means then you're going to have particular countries that will be left behind in the race. While other countries are paying a lot to avail themselves with that, other countries are slow and still waiting, and probably coming in to improve on what already is existing. So there is competition between scientists, but the interesting thing is scientists will always be chatting. We just don't know whether it's the Chinese or the Russian or the Moderna or the Pfizer or the AstraZeneca that will treat you, or rather the Johnson and Johnson, whether that's the one that will treat you. Amina, you are still there, and you've already muted. Now, I was just trying to, push the argument in terms of the African countries being unable to come up with a vaccine. But in the meantime, what do you think then we can do, considering that we cannot agree on how to disagree, or even agreeing on how to agree?
Okay, thank you, Sheikh. I'm not very knowledgeable about what and which and what, but what I think is, like, as you said, it's like everybody's fighting for power. So if they cannot think about us and work together and come up with a vaccine, we're going to continue doing what we've been doing, which is protecting ourselves by using the home remedies. I mean, I feel like I was kind of pushed in a way to be vaccinated, like both of them, just because of my job. Because if I wasn't vaccinated, I wouldn't be allowed in. But I made it clear from day one that I will always go for Pfizer, because I knew Pfizer, at least they had a history of having manufactured a medication, a certain drug. But I wasn't sure about Moderna, Johnson, and all these new things. I was very scared of them.
So very skeptical about them. Now,
yeah.
do you think though that in the UK, for example, we relaxed too fast, too quickly, considering what had happened? I mean, from the 4th of October, how quickly people threw away the masks, football pitches are filling up, pubs are filling up, and people have gone to normalcy as if, the disease that was supposed to be there with a simple vaccine, it has disappeared. Did we relax too quickly?
No, I don't think so, Sheikh, because in the first wave, I was in Scotland, and I know how strict they were. I saw how strict they were, like locking away people. So again, this went back to mental health, whereby we are affected so bad. People are getting so depressed, being locked away from families, loved ones. I mean, my sister had just had a baby. I really wanted to be with my sister, but I couldn't because of the lockdown. So I felt like how England did it, the way it did relax, really, it was good. And at the end of that day, I don't think there was much of a race after the relaxation. I don't think there was much of a race. So I was really happy. People's mental health improved once the rules were.
But I mean, people's mental health, yes, was improved as a result of this. But did we not expose ourselves to unnecessary dangers? Because again, the very thing that we were supposed to do to stop people contracting or infecting each other are the things that we opened up straight away. We were back to pubs, we were back to football stadiums, we were back to filling up buses without wearing any masks.
But at least we were aware. We were aware of what's going on, because I know if you were on the public transport and you're spotted coughing, people will be running away from you. So yes, we did relax, but we were actually taking precautions. We're taking good care of ourselves. And people took trouble of using these sanitizers, which were everywhere. So yes, like as I said, I was at the front line. I was everywhere. I was with people, but I didn't catch it, alhamdulillah. But I did welcome the relax, which happened in the England. And yes, I kept the mask and everything. And I felt that, no, it was really good. It was done at the right time, because still people did take our precaution and people are very careful.
So how do you feel about these new restrictions that are seemingly becoming? Are you worried? Are you afraid about this new strain of the virus?
Sheikh, I'm just at the time when I'm just confused. Everything has just become so political, like the movies we've always watched where the government now they've taken the control of humanity. They've taken control of us. They're going to press this button and we just jump. I've got nothing to say. I'm just watching to see what other drama we're going to go through. They're going to push us into, because I just don't understand this. Because we were promised once the vaccination is ruled out, everybody's vaccinated, double jab, they're going to open up.
Yes.
Any more lockdown, I'm now speechless. I just leave them to do what they want to do, because I'm confused. I'll just pray. Thank you so much.
Alone. You are not alone, I can assure you. Well, the program is Come Let's Talk with me, KASSIM KAYIRA. We are live on 75 W Radio and live on Umma Connect on YouTube and on Zoom. We are streaming live now. We're hoping to get some health professionals to come and help us navigate through a rather difficult, terrain. But actually, probably we didn't need even the health professionals. It is our experiences, it's the personal experiences. Have you had to change your plans, for example, that you are having, considering what is beginning to happen? Are we going to find ourselves now having to be locked up into hotels again to be able to, cater for that? In Uganda, I remember, and actually it's not only in Uganda alone, you actually see the kind of how COVID has become a business. And this is one area that we sometimes don't interrogate enough. The way COVID has become a business. If I have been tested in the UK and found to be negative, 72 hours of flying into Uganda, why would I need another test if I've been tested? Once I've been tested, you test from Uganda. If you have been, you have been cleared that you are fine, why would you need another test once you arrive in the United Kingdom when it is within the 72 hours of your particular test? It is business, because every time you're getting tested, you are actually paying, and this is going to a particular company. Here, if you look at the list of companies that were approved to carry out the tests, something smells fishy. And sometimes, actually, once you start going down that route, it becomes more conspiratorial. And sometimes you just have to sit back. Think about the hotels. In Uganda, the choice of hotels, for example, and this is something that actually starts going to other countries, but I'm using the practical examples of where I know. It was ministers, either people related to ministers, connected to ministers, who would, smile to the ministers' faces, that ended up getting, the contracts for their hotels to receive the guests, to receive the guests into the choice of hotels. It was not every hotel. There were particular specific hotels that were chosen to be hosting the COVID people who were in quarantine waiting, for the period. They either had tested positive and they had to be, dealt with. Actually, those who had to be dealt with were taken to hospital. But those who are waiting for their results or in quarantine over that period of time, self-isolating, they had to stay in particular hotels that received a lot of money at the time, whether from the government or from the individuals who had to pay to stay in those places. This was business. And, it is difficult not to think about it in that context. Beck, I see you're back again. Yes, please, unmute yourself.
I have a question. I just want to ask that if I was to be vaccinated in Uganda, will that be accepted in the United Kingdom?
It would not be accepted. And actually, that is another very interesting, but because a lot of the AstraZeneca was coming from India.
Okay.
It was coming from India, and that they were saying they would not acknowledge. They would not acknowledge the vaccines that you had received from elsewhere. In fact,
but then they are the ones that give us the vaccines, right?
I'd received my first jab in the UK, traveled to Uganda, and then my time for my second jab found me in Uganda. And I was considering whether to go, since it was available, and I could go and get my second jab. After going to the AstraZeneca, I called up and they told me very clearly they wouldn't acknowledge, the AstraZeneca, the same name, but different now, whether I'm getting a generic or whatever. That's the story. But
that's very interesting, isn't it?
No, it is interesting.
Yeah.
But of course, now it tells you whether now we are getting the right vaccine or whether there's something that is hidden. Safina says, Assalamu alaikum wa rahmatullah. On one hand, I try to understand why governments that are concerned about their people seem to be forcing people to get the vaccine when the infections are high and people are dying. The government is blamed for negligence. Okay, let's see. The AstraZeneca in the UK was also produced in India. Yes, it was produced in India, but under a special order. So that's the interesting bit. They wouldn't recognize the very AstraZeneca produced. It's just that, like for example, when you go to China and you order your iPhones, you'll have 3 types of iPhones, and each one costing a different amount of money. So depending on your pocket, you'll get a different version. Or how you end up with clothes that are made all in Bangladesh, for example, they come here. The ones that go to Primark will cost £2 or £5. The ones that go to Next will cost, or Marks and Spencer's will cost £20. It's that packaging. I mean, it's all in the packaging. Well, there's skepticism about vaccination in Uganda. Everything in Uganda has been duplicated to the point of people being given water for vaccines. That's another side of the argument. And Zamura says, well, we are turning into guinea pigs. Can you imagine? Well, may God, Allah subhanahu wa ta'ala, protect us. I think a lot of times you find that our protection really, really lies with Allah subhanahu wa ta'ala. Let's bring in more people into the conversation just to sort of hear where they are. Abu Mustafa Najim says, I heard you had to pay 1 million if you don't take the vaccine in Uganda. Is that true or Tiwani? No, that's not true. At least as far as I know, that wasn't true. But sometimes there were people who actually went back door and tried to pay to get the vaccines. They are the ones actually who ended up with water in their veins. How they survived, Allah subhanahu wa ta'ala only knows. Jamila, I saw you giving us salam. I'm sure you have settled in now. Probably we should hear from you. Jamila 1. Assalamu alaikum. Hello, Jamila 1. Jamila, can you unmute yourself? Are you in a position to speak? Or in the meantime, I've been seeing Chance hiding out there, and Ida. Ida, I'm coming to you first, and then I'll go to Chance K. Ida, assalamu alaikum.
Walaikum salam wa rahmatullahi wa barakatuh.
There is a way you come and go into Kamori and hide there quite often. How are you today?
Alhamdulillah, I'm good.
I mean, are you worried about this new strain? Let me get your reaction.
I'm not.
Why is that? Is that because you're fully vaccinated or?
Yes.
Okay.
And I put on my mask.
Yes. You think that is enough to protect you?
The thing is, how can I say this? The thing is, I work with them, so I'm not scared anymore. I'm now stronger. I used to be scared, but now I'm stronger.
When you say you work with them, who? You work with COVID? Or
yes, I work with COVID patients.
Right.
Yeah.
And what have you been noticing recently? Are the numbers increasing? Are the numbers stable? Or are the numbers falling?
Yeah, it's increasing compared to like right now. We are in November. Around. Pardon?
I think it's someone who bleeded in. Yeah, no mind.
Yeah, around August, the numbers were going down.
Yes.
And now you can come on the shift and say, oh, when you're having handover, so and so is COVID, so and so is COVID. Now it's a norm. Every day, you know, I have to make sure that I take my heart.
Right.
So I'm not scared anymore, you know.
Oh, Jamila, I can see you there. Yes, I'll be coming to you later.
Only problem that people, they don't want to listen. When you get a relative and say, they come like 4 and say, only one person. Why? I say, please, for your own safety. But they don't listen. And those who are saying no, some of them they are not even vaccinated. So and that's why
coming into such a vulnerable environment, the likelihood of picking up the infection or spreading it in case they have it becomes much higher.
So people just they have to be very careful. I won't say much, but we had an incident, you know. You come from outside and then you end up, you know, grabbing something, and then you come and blame the hospital, you know.
How do you mean?
I won't say much. As I say that you come to visit somebody and then you grab something. Then you come, you make a phone call. Oh, I'm like this. I say, well, you were told. First of all, you came without a mask and he says, put on your mask. What do you expect? Now stay home. I think when I talk like that, you understand me. I don't want to say much, you know. This is a public.
This is a public forum. Yes, it is a public forum. And I'm getting the hint at what you're trying to imply. Yes. But I'm just wondering now, how do you think we should overcome this situation? We just go on with masks and whatever. How do you think we should deal with the current situation?
I think people should go for vaccination, and people should keep on putting on the masks in public areas. Don't go and visit people if it's not necessary. Go to visit somebody when really you have to go. If you don't need to, don't go to somebody's house. Eventually, the disease will go away because you don't know where that person went, you know. That's how we are going to spread it. Everyone should stay in their houses.
Yes.
Yeah.
Okay. Thank you very much, Aida. We managed to get you out of Cambodia. Amina is back. Amina, you have something burning? Like, do you want to speak to Aida?
No, just quickly, thank you, Sheikh. I just wanted to respond back to my sister who just spoke. Sheikh, it seems like this COVID has become a bit like more, I don't understand. Basically, the environment with Wanga, the environment where we spend much time, is how we're gonna look at this COVID. So, because if you speak to somebody who spends so much time in the hospital, they'll be using that language like, where this don't visit your relative and all this. But then if you get somebody who's been maybe at home for some time, who's been working from home, they will know that, okay, you'll put on a mask. Mask is good because obviously we get so many people who cough without touching their mouth. That's a very common practice here. And you know, yes, you are protecting yourself. But it's very hard. It's very hard. Nothing really. I won't say nothing makes sense, but I think we'll just follow what the government tells us. The guidance.
It is confusing. But now, in situations where you've seen government, especially if you are a person that watches movies and series, and you look at, you know, how the government sometimes cannot be trusted, you know, especially when you consider, you know, situations where they come 10 years later to apologize that we did. For example, now the UK government has been blamed. They released one of these declassified files where they've come up to admit that when they invaded, I think, Iraq, they didn't tell British Airways about the fact that they were going to invade, and British Airways staff ended up being held hostage for nearly 2 weeks there. And you know, there has been that anger that has been thrown, you know, at the government as a result of failing to say. And all they've come out to say is, we apologize for not having told you, but not apologizing, or rather apologizing after an incident has happened. I think doesn't add much value.
Yeah, it's true. But again, that's why we only have to put that trust in God, in Allah. Because Sheikh, even Pfizer, the one we like, my favorite, Pfizer has got its own history. How we came up with this, I think, hypertension medication, and then it ended up causing men to get a different function, and they apologized, they paid their fines and all that. They've had mistakes in the past, and these are the people who are the number one in making a vaccine. And I cannot force anybody that go for a vaccine because I got it. But to be honest with you, I don't know what's going to happen to me in 10 years' time. 10 years.
You won't turn into an elephant, inshallah.
I hope so.
It seems to be back to speak to you. I mean, you remember there are some people when they were doing trials for a vaccine. I remember some time back, it's around 2003, 2005. There are people who almost turned into it. I think their hands or
they turned black. They lost the circulation. Yes.
Yes. So Alhamdulillah, so far it is 6 months and we haven't turned into elephants. So we can hope we are still okay.
I hope so, but I cannot force anybody to go for a vaccine. It's like we'll just leave it there. The government has made its guidelines.
Everybody... hold the line there. Aida seems to want to speak to you. I think you spoke to her.
My sister. Hello?
Amina.
I want to talk to Amina.
Yes, Amina is hearing you.
And I'm going to use Uganda. Otya kubanga ntino tokola you said something about visiting okukyalira gundi aba relative bo, eh?
Agambye nti abantu responding okusinzira ku mbeera ze tubeeramu kati gwe ekyokolera eyo kubanga olaba abantu abo attitude yo ina bwefaanagana. Have I misrepresented you?
No, you are right. Yeah, that's what I meant. Yeah, where we come from, really, to choose a mind affair on how we're gonna deal with this COVID.
Yes.
Yeah.
Let me tell you something. Unfortunately, I had a colleague, she's still there. She finished work. We were told, don't go home ng'oli mu uniform. Mukyuse engoye zammwe. Okitegeera? Era even right now we are changing our uniforms. This colleague of ours, oh, it's all right. Yava ku mulimu n'agenda eka. Ayina maski, she wash her hands, everything. Guess what? COVID agendera ne ku ngoye. Bawe yafuna COVID. It took only 2 weeks. Omusajja n'afa. Kubanga yali ayina underlying diseases. Kyenvudde nkugamba omuntu wajeewange ng'oba nva kukola. You don't know ti oba ntaddewo egundi zange akuttewo agenze eka. Ezze kukyala bulungi. Atutte obulwadde. Okitegeera? Ate ng'abadde ng'alina mask. Ntuuse ewa Aida biki, you know. People don't get me wrong, mpa example.
Oli mutuufu nnyo. Oli mutuufu naye era ekyo kiva ku an individual. Kubanga bw'oba omanyi nti n'ova mu area omuli eri infected. Lwaki toyambulamu engoye zo n'ozisiba mu ka bag?
We were told. Ng'abamu bafuna ne zi shower somewhere nga tanagendaka.
Exactly, yeah. We did that as well, we're doing it.
Naye omukyala even up to now akyagamba nze natta bba wange. Okitegeera?
Yeah, ekyo kiraba nti era this goes back to individuality again, how people see things. Kubanga despite the fact nti mmwe mwenna mutya ffenna tutya nti COVID agendera ku ngoye, naye era osangamu omuntu n'abeera lazy.
That's thing. Making okuba strong. I'm not scared of COVID. Kubanga wentuuka ku mulimu, I change my clothes. Nenyambala bye nina okwambala. Wemanya nti bantadde section ya COVID, I know what to put on. Okitegeera? Oli ne wankubira essimu sigikwata ng'ate ebeera mu nsawo.
Yeah, basically it's about being sensible, really.
Nali anti-vaccine. Naye ku kye nalabako ku luno. Nagamba, I went even I've had my booster even nagifunye.
All right, thank you very much, Amina and Aida. And that is the beauty of this conversation. We get people talking, and that's why we say, come, let's talk with me, KASSIM KAYIRA. We are live on 75 WA Radio, and we are live on Umma Connect, on YouTube, on Facebook, and on Zoom, where we are at now. Abu Najib, if you can unmute yourself, please. Abu Najib, I think you seem to be really amongst the worried ones now. Has he disappeared? I've just seen him here now. Abu Mustafa Najib. Abu Mustafa, if you can unmute yourself, please.
Assalamu alaikum.
Wa alaikum salam wa rahmatullahi wa barakatuh. Scared about a looming lockdown?
Yeah, I'm guessing there might be a lockdown soon, right? You know, I hope, we will be okay, but with what is going on, only Allah knows best.
Are you worried, bro?
No, not really. I wouldn't say I'm worried, because I know this is getting out of hand, with the things that, a bit too much politics involved in this sort of thing, We just hope for the best, though. We can't really do much. We put our hands up, We put our hands up. Yeah.
Abu Mustafa, you see, I agree. The politics really seems to be coming in. But my worry is, where do we draw the line between politics and health? Because we know the politics that is involved, the companies, the people that are benefiting. It's Boris Johnson's friends, or elsewhere, even in other countries. The Museneros, you've seen Musenero being called to parliament to go and account for money, and she's unable to account, saying she's only accountable to the president. These issues have raised particular concerns. So there's the politics involved on one hand, but there's also the health that is there. We've seen people, we've lost people, we've lost close people. So in other words, COVID is not a joke, it is there. Where do we draw the line between the politics and the health?
All we can do, I guess, is just take precautions, safety measures. We do what we can do, washing our hands, wearing the masks. You know, if you have to, obviously, you can't go to the to the shops without a mask now. Anyway, you can't go to public transport. The mask is being made compulsory, I believe, from today. For those that don't know.
Yeah.
So if you go to the shop, make sure you've got that mask. Obviously, they won't let you in. Some shops, maybe some will let you in, but the big shops, the Audis, Argos, Asda, all the ones, you can't. They won't let you in. But yeah, you put your mask on, wash your hands. The ones that believe the vaccines will help them, maybe you can take them as well if you believe they help. You know, I mean, like if you think that they will, be beneficial. I mean, the booster, because obviously there's a booster as well available. That's all we can do. We just take safety measures. It's not all doom and gloom. Bi-idhn Rahman. We can only try to protect ourselves to the best of our abilities. No.
Well, in the chat room here, I mean, I was saying we seem to have lost control of everything going on in the world, and we should just pray for Allah's protection. And Baker here is saying, of course, Iceland said no, they won't enforce it. Yes, they didn't say they won't ask people to wear masks. They will ask people to wear masks, but they will not enforce it because they do not have adequate staff. Staff are already overstretched with the amount of work that is there. They cannot allow or add anything to that. Taking precautions is the way forward, and using home remedies. So, Abu Mustafa, how have you managed to? Did you catch COVID at all? Hello, Abu Mustafa. Oh, you have already muted. Abu Mustafa, I was just asking you. Did you get COVID at all?
No, Alhamdulillah, with the permission of Allah, I did not get COVID. And I survived COVID, but you never know. Anything is possible, You can only, as I say, try your best to, obviously, put your tawakkul in Allah, put your trust in Allah, and take precautions, because those two go hand in hand. You have to do both. But yeah, I didn't get COVID, and I tried to stay healthy. I'm a person who does exercise. If people can do exercise, do that. Whatever you think will work for you, I'll guess that will be the best way. Don't be sitting at home and worried. And to be honest, some people actually, it might not have been COVID that actually killed them. Allah knows best. It could actually been the mental state that they were in, and the panic and the worry, anxiety, all that sort of thing. A lot of people have that. So maybe that could be one of the things that if people keep themselves busy, if they can try to check on other people as well, that can actually help, check on your family members, check on your friends. You need to call people. If you don't do that, maybe you're going to be lonely yourself. So don't wait for people to call you. You need to call them. So that perhaps that helps you. That's my take.
Fantastic. Thank you very, very much. Ali Buembo, you had a point here that I think would be good to let other people know. Ali Buembo, salamu alaikum wa rahmatullah. Brother Ali Buembo. Ali Buembo, salamu alaikum. Hey, Mr. Buembo, I'm trying to get you to unmute yourself. I don't know if you can. In the meantime, I'm looking for Aisha. Aisha, what did tell you? Hello, Aisha. Assalamu alaikum. I'm looking for Buembo and Aisha. Whoever comes in first, we just need to hear from you. Ali Buembo, are you able to speak? You just typed in a message there. I wanted to interrogate it a little bit further. Aisha,
Alaikum salam wa rahmatullahi wa
how are you?
barakatuh.
Long time I haven't heard from you. Are you well? How is the family?
Surely, yes, but I'm quite not in the state of talking because I'm at work.
Oh, you're at work. Okay. Well, are you worried about this new one before you run away?
I'm not worried about anything because, I mean, it is what it is. Like, we have to learn to live with it, to take the measures and precautions.
Are you going for your booster jab?
Sorry?
Are you going for your booster jab? Have you already had it, or are you going for it?
I'm not going for anyone. I've had all my 2 vaccinations. I'm not going for any more, whatever booster, whatever they say. So I'm not going for any more. That's enough for me.
All right. Fantastic. I'll leave you to continue with work. Thank you very much. At least we've heard your voice. That's the message that was being trying. Mustafa was saying, check on each other, check on how people are doing where they are. Good to hear from
Thanks
you.
very much, mashallah.
Barakallahu fikum. Ali Mwembo typed in a message while I'm trying to get him. I don't know if he's unable to unmute himself. But he's saying now TfL, that is the Transport for London, they are introducing fines now, buses and trains of up to £200 for anyone who would be found not wearing a mask. I think the problem has been actually getting this into practice, getting to effect this. If there will be spot fines, how they can follow up on people to be able to get them to pay, and whether there is a law to that effect. I think legally, because these are bylaws or measures that have been brought in as a matter of urgency, but whether that can be effected in actual sense, I think that's another thing altogether. Ali Mwembo, I wish you could come in and probably just try to delve in just a little bit into that. Someone is saying money at any opportunity. I think it's about the fines that they want to make money at any opportunity. I wish you could hear from the amount of people that have lost work. Oh yes, many people have lost work. Amina says, thank you, brother speaker, for mentioning the mental health issue during lockdown. That was Abu Mustafa, Abu Mustafa Najib, who raised that particular issue. Well, I think we should now be starting to wrap up. In 42 minutes, we have 18 minutes to go. Time to actually check on your messages, both on Facebook as well as here. Ali Mwembo says it's evening standard for today. Yeah, but Ali, I wanted to hear from you whether you are actually worried at all about where you are at and how you are coping. Because at the start of the program, I was talking about the fact that we've had a difficult week for those in the UK, difficult week where we've had very strong winds, the storm Arwen, that has actually destroyed more than 50,000 people are without electricity and gas at this particular moment in time. Many are without connection to network. Mwembo says, I'm at work, Sheikh. Okay, noted. Thank you very much. And so in the midst of this now to come and get the news of a new strain again, which has been detected in 10 countries across Europe now. And many of these countries now have started introducing restrictions. They have banned passengers arriving from these particular countries. They've setted out 8 countries within Southern Africa, which I think, as Dr. Ayeola was saying, is kind of segregative. The decision, the choice was kind of wrong. The manner in which it has been done actually raises very serious questions just in terms of the credibility of Western governments when it comes to dealing with matters Africa, especially when it is considered as an African problem, yet it is a global issue. But also very interestingly, 3 people who have tested positive for this new particular strain in Scotland are people that have not had a history of travel. It's not like they've come from outside or whatever. But actually you find that the bigger number of people who have tested positive again for this particular strain were people that attended a particular event in Scotland. They are not coming up to say it was COP26, rather the climate summit, but 13 of these people actually were people who were attending a particular conference within Scotland, most likely the COP26. They haven't issued to say that, but 3 people had no history whatsoever of travel or even attending part of this conference, which now raises the question whether they've been in contact with people who were there, or if they've caught their own, and it might actually be here when they are thinking it's just in South Africa. Raises serious questions, but of course, a lot of this now goes into the hands of Allah subhanahu wa ta'ala, seeking his help and intervention in a matter that seems to have overwhelmed us as human beings. Just the normal human beings, we seem definitely to have been overwhelmed by what we are facing at this particular moment in time. Farida Namsoke, are you there? Are you able to speak at all? I would like to hear. Twagara kumanya mberazo. Mswahili would be saying tunataka kujulia hali. Farida, are you able to speak? as we start our journey to wrapping up. And Hajati Zamzam, now I go manage to get Aida. Hajati Zamzam, are you there? Hajati Zamzam is always on, but always in the Kamoli as well. So probably, hopefully, we might be able to get her to come out of the Kamoli tonight. Hajati Zamzam, are you there? Okay, let's go to iPhone. iPhone, Assalamu alaikum. Hello, iPhone. And there's Mrs. B. Mrs. B. Hey, subhanallah, the silence is way too much. You have left me in the sitting room alone, and you have gone. Hasfa, I don't know if you are able to speak now. You're still tied up wherever you are at.
Walaikum warahmatullahi wabarakatuh.
Alaikum salam wa rahmatullahi.
You have the phone in the living room. We're listening.
Well, you can't be listening when you start talking to yourself. I think that's the dilemma, especially, and now that gives people like Baker the strength to claim that he has converted all of them to his side, or the non-vaccinating. We were benefiting. Well, thank you very much, Abu Mustafa. Hasfa, we managed to hear from Zamunda, who is in Maryland. You are in a different state. You are not in Maryland.
Same state.
Oh, same state. Okay, that says it. Doesn't give much, but definitely you would have a view. Do you agree with what his submission was, just in terms of how Americans are taking this whole, COVID thing?
Yes, I heard what he said. He's sitting right next to me right now. But to me, this COVID, it has become like the new normal.
Right.
Life is just going on as normal. We go to the stores, people have their masks, those who don't have their masks. I guess sometimes even people who get this vaccine think they have superpowers because
Yes.
I don't know if we give them a false sense of security or give them extra security, and they think they can survive without wearing a mask or taking precautions. So if you go to the mall, and some people don't have masks, even if they're elderly. But to me, I think this is like the new normal. I don't even see us closing here in the US. I'm worried about I think about holiday, Christmas time now. It's extremely busy. Places get packed, extremely packed, but I think life is going to go on as usual. The hype, we had the Delta. What was the other one after the Delta? Lambda.
Which would call it Lambda.
Yeah, I think this is like almost like the new normal. It's like, what else? Malaria more than it kills more people than COVID has killed in the last 2 years.
Absolutely.
We forget to even mention about that. Every other diseases are still happening. So to me, alhamdulillah, I just take my precautions, and I don't even want to pay attention to the news or even think about it. Yeah.
But where do you think we go from here? Because probably as we wrap up, I think that might be the question to everyone participating tonight. Where do we go from here? Because when you say it looks like it's going to become the new normal, how normal is this normal? I mean, how do we pretend? Do we pretend it's not there? Do we acknowledge it's there, but then decide how we live with it? I'm trying to sort of see, when you say the new normal, where does that new normal take us?
To me personally, I say we take care of precautions and not lose our faith. Because you think about the politics behind it, and then you think about the hype. I have one of my aunts that works in the COVID one of the COVID units, and to her it has become, it's like, oh yeah, I had like 4 of them, but it was all right. That it has become like kind of like normal. It's that the hype is there, like okay, it's still killing, but not as much as it is. And for her to even be scared or worried that, oh my God, I'm on a COVID flow. No, we give her the medicines and whatever. We have to just accept that it is here now. All these mutations and variants that are happening, I think whether they are playing on a spike that it is there or maybe it is not there. I think we just have to accept that we have corona, it's here to stay, and we keep our faith in Allah that we'll be fine and we take our precautions.
I've been thinking about COVID and Mrs. B finally is here. I'll be coming to you, Mrs. B. Thank you very much. I was just wondering about COVID and diet. Does it help to eat well? You know, because just like many diseases, how does that contribute at all? I don't remember hearing a bit of this in terms of the conversation.
I think absolutely, because think about it. Still, if you want to eat McDonald's, you want to eat fast food, you want to do fatty food, heart disease is also there. Diabetes is also there. All these other diseases are still existing in high rates, in such a huge abundance of these diseases among the people, and they're killing them, and they're getting sick, and we get worried about corona. And then sometimes people get depressed and scared, they resort to eating because it becomes their comfort, and then it gets people sick. You just can't think, I don't know, you can't even draw the line. I think we just have to accept it here and just continue living our life. Like Aisha, Sister Aisha said, I got my two, she got her 2 shots, that's it. This thing, there's a booster, then from there, they're going to tell us there's going to be a pill you can take once a month, then it's going to be, there's a drink. Then
there is an ointment. Yeah, before we know it, our entire bodies are immersed in this.
Some special kind of clothes to wear. But it will never stop. But if you really stop in fear, and even the more we fear, we have children, the more we transfer the fear to the kids. And then they think about the lockdown again and how depressed they were in the house and how they were not seeing their friends. So, and it just takes over everything. So we can't let it consume us. We take our precautions and have faith in Allah. I think we'll manage.
Thank you very much, Hasfa. Thank you very, very much, Hasfa in the United States. Mrs. B, you have the mic. Finally got you. Assalamu alaikum.
Alaikum salam, Sheikh. How are you?
Alhamdulillah. How are you?
Good.
Your voice is very, very low. Do you mind raising your voice a little bit?
Can you hear me now?
Yes, I can hear you loud and clear.
MashaAllah. Like I was saying, having the vaccine like a personal choice, but you have to think about the wider community and your wider family.
Right.
On a personal level, I've had the 2 jobs. I've had a booster. My husband, Mr. Boimbo, he's had both jobs and he's had a booster. Our oldest, who's about 19, she's had both of them. My 16-year-old, he's also had his first job about 3 months ago. MashaAllah. But then it's not only about you, it's all about the wider community. We work with the vulnerable people, right? You don't know whom you meet out there. If Allah wills, it's His will. But you've had this opportunity to get it. Some people want to pay for it, they can't get it. Okay?
Right.
I know they say, oh, people have had the vaccine, they've still got the COVID, they've died. That's Allah's will. But I work on the front line.
Oh, fantastic. That's nice to hear. Yeah.
People have had the job, yes, they get unwell, but they don't get so hit as those who haven't gotten it. And that's for a fact. I'm in ED, I'm in intensive care. There is evidence. I can vouch for that.
Right. I'm sure Baker is listening in now.
I've heard about Baker. I had him. He's entitled to his own opinion. At the end of the day, it's if you don't want it, that's your personal choice. But if
I was only mentioning Mrs. B because his hand is up and I know what is coming up other than talking about
I know. Baker, stay. I'm coming. But at the end of the day is if you don't want it, it's your personal choice. No one's going to hold you to that. But if you're going out and mixing up people, and I've been there, there's experience. I know a couple, wife had it, husband didn't have it, he brought it home, she got hit and she died. He's never forgiven himself. And we fortunate here get it for free.
Yeah.
But then at the end of the day, it's your own personal choice. But if you're out there in the community, what's good for you? What's good for your family?
Absolutely. Absolutely.
You have to go back.
What's the new normal then?
That's homework for everybody else. You may be, I'm not calling it selfish. You may think you're self-sufficient, but they're more vulnerable out there. You're putting them at risk.
Fantastic. So, and what's our new normal then? Because the suggestion was we are living with COVID now. We have to find ways of living around it or with it. What would be your suggestion for a new normal?
No. To be honest, it's normal to me. It's been normal for the last 2 years. Before anybody else knew there was COVID, I knew there was COVID, by the way. I got exposed to it 2 months before it was announced in this country. Okay? So at the end of the day, it is what it is. Life goes on. We only have to respect and follow protocol. If it's not for you, for your nearest and dearest, or for the whole community. That's my take.
Fantastic. Thank you very, very much, Ms. V. And have a very good night wherever you are. We're just beginning to wrap up. 4 minutes to closure. Baker, tomorrow is Bridging the Gap. What do you have on?
Tomorrow we're going to be talking about, basically it's a continuation from last week. That's what we are going to be talking about. A lot of men have so many issues, you know, but they have nowhere to turn to. There's a video that's gone viral where there's a gentleman, he had a family issue, but he didn't, I don't know, basically what he did was record himself and share it on social media, you know, and he managed to literally just let the whole world about his family issues. So we're continuing on men, and also we're asking the question whether... Sorry?
The Ghanaian one?
No. Where I think his kids were becoming a problem, where they're taking advantage of him. Yeah, and also we're trying to find out whether women are the man's #1 problem. So that's the continuation to tomorrow's topic. That's what we are discussing tomorrow. But in regards to this topic tonight, I want to just share my COVID experience. By the way, if you could give me allow me maybe 2 minutes or so. I got COVID earlier this year, I think, and actually people were happy.
Just to let you know, I've left Mrs. B's microphone open. So.
Yes, that's fine. Yes, please leave it open. Please leave it open. Yes. You know, I got COVID.
Assalamu alaikum, Baker.
Wa alaikum assalam wa rahmatullahi wa barakatuh.
I
got COVID earlier this year, by the way. I think, I can't remember, earlier this year I got COVID. And actually people were happy I got COVID. People were happy about COVID, seriously. People could phone me up. Some people phone me up, and I could tell by the way they're talking. They're like, "Yes, see, we told you COVID." You know, I'm like, "Wow, really? Seriously?" I could not believe it. I was like, "Wow." So it's divided people up to the point whereby people feel like I'm not entitled to my own opinion. You know, people feel like because Baker thinks like this, let's pray he gets it. Let's pray. But it shouldn't be that way. I'm entitled to have my own mind, my own thoughts. But I got COVID. I remember one morning I woke up to pray in the morning to pray Fajr. And I went to go ablution properly, went on the prayer mat. And then for some reason I can't breathe properly. I felt like I could not breathe properly. I was like, oh my goodness, what's happening? I started picturing myself going to hospital. I started picturing the doctors coming to the house, like the ambulance. I was like panicking. I got up, sat down, got up, and then I went to the kitchen. I drank pineapple and ginger mix. I think monanas, that's it. Then I took a tablet of zinc. I took vitamin C. I took literally just took everything, antibiotics.
That sounds like a panic to Baker there.
That was a panic. So I was panicking. I was saying, what the heck is happening? Seriously, I thought, let me share this, you know, because I was like, what the heck is going on? But then I sat down and I remember my mom had given me a OBS reader. So I put it on my finger and it read that my oxygen is okay. Straight away, the panic went. Straight away, the panic went. So I want to wrap it up by saying that our minds are very, very powerful. Our mind is a powerful tool. You know, the brain is a powerful tool. Once you get something on your brain, once you start feeling like, oh my God, I cannot breathe properly. Oh my God, do you get what I mean? You straight away gonna get into a panic. So I just want to let everyone know that just know you can survive this. If you get COVID, don't panic. Don't see yourself going to hospital. Don't see yourself dying. Just take it, just concentrate on getting better. You can get better, you know, but if you start worrying, I think that's when before I used to ask myself, what are panic attacks? People talk about panic attacks, but literally in that moment, I was like, I don't even know, you know, I just lost myself for a second and I could just not believe what's happening. But then as soon as I put the OBS reader, which is actually a very good, useful tool to have at home, you know, have the OBS reader, that thing that reads your oxygen levels, you know, so that you can literally, sometimes we worry when we shouldn't be worrying. So we
Thank
can
you
survive.
very much, Becca. I wanted to be very strict with time tonight, but that's 1 minute you've eaten into the time.
Can I
And
say something,
actually,
Sheikh? Can I say something, Sheikh?
your submission has made NK laugh so loudly, saying Becca, and she's been in Kamodi throughout, but managed to come out just to laugh at Becca eating, taking Munanas and saying Munanas is Mwenge. Yes, Mrs. B, go ahead, please.
Just a quick one.
Yes.
Your oxygen saturation shouldn't be like a barometer for your COVID status. There's also other things that we take account into. So yes, you might have proper SATs, but then what's happening to your pH, your lactate? You may have a proper pH now. What happens in the next 30 minutes? That's what you have to look at. So it's best to get a clinical opinion at some point.
Fantastic. Thank you very much. Yes, and what's the pH there?
I forget about the pH. Your doctors.
I was beginning to translate that into pilau. Might be my pilau level as pH now becoming the point of conversation. Thank you very, very much, everyone who has participated tonight.
By the way, Munanas is not Mwenge. I think people need to test it actually. It's very nice. You know?
Well, thank you very, very much for an interesting, difficult conversation, yet actually interesting finally as we get people's experiences. In fact, probably if we had doctors, it might have complicated it. We've got people who are working in the profession, bringing in personal experiences from the room, from inside the room, and then we're getting people's personal experiences, which I think actually has given us a much wider perspective. Hearing from the Netherlands, from the US, from UK, we only missed Uganda to hear what's on the ground at this particular moment in time. Thank you very much. Bridging the Gap tomorrow, 7 o'clock, we'll be coming in with Becca, and he will be looking at problems that men face without being able to speak about them, and whether actually women are still men's number one problem. That's his program tomorrow. If you can, please tune in. Next week, we've managed to get confirmation from the Director General of Uganda Investment Authority. We'll be getting them to hear part 2 of our diaspora investment, looking at the opportunities that are available for people wanting to invest back home. We will be hoping to get people from URA as well, but we've asked specifically to have that because there will be an element, a segment on tax. So prepare your questions, all going well, and in case there is no breaking story that actually comes and overtakes that story, we have confirmed with Uganda Investment Authority and URA to be able to come in, and we are trying to get immigration as well to come on board, especially on issues like to do with the dual citizenship as we talk about diaspora investment back home. Thank you very much and have a very good night. May Allah subhanahu wa ta'ala keep you well. Let's meet next week, inshallah, for Come Let's Talk with me, KASSIM KAYIRA. For those who can, tomorrow catch up with Becca on Bridging the Gap. Thursday is Parents Forum again. And then on Umma Connect, actually tomorrow, we get Sheikh Ismail Kata as usual. Thursday, we might be getting Professor. Actually, I think Hafsa, you could have given us Thursday if you've decided on the topic yet on Muslima, but I'm sure that's the day we also have Dr. Gisuli as well coming in with his fantastic take, and Sheikh Kanisa as well coming in as well to discuss the 99 names of Allah subhanahu wa ta'ala, if I haven't forgotten. Thank you very much. Keep it here, inshallah. Let's keep talking. That's the one way of actually dealing with our depressions and stresses of life and making sure we keep healthy. Stay well, stay safe. See you next time, inshallah. Assalamu alaikum wa rahmatullah fi amanillah.